Welcome, everyone, to today's webinar on business models and spiritual care, making chaplaincy sustainable. My name is Michael Skaggs. I'm Director of Chaplaincy Innovation Lab Programs, and I'm very pleased to welcome you to today's event to talk about really one of the most important parts about spiritual care today and well into the future is how do we do this in a way that is materially sustainable? Obviously, the work that everyone here is doing is vital and important. And if we can't pay the bills, none of it matters. And so I'm very glad that we're going to have a chance to talk about this program that has been sponsored by the Templeton Religion Trust. And we're going to hear about some research, some interesting and creative ways of structuring spiritual care. And then, of course, we will open it up for discussion at the end. This is being recorded. And so if you miss a point that you would like to know more about, or if you need to step out, don't worry. You can always come back and watch it later. This is free and open to the public, as is the recording. And so anyone and everyone can come and watch it as many times as they want into the future. Let me introduce our guests, and then I will hand it over to Trace to keep us going. Suyan Pak is Vice President of Academic Affairs and Dean at Union Theological Seminary in New York, longtime collaborator of the lab, one of the leading educators in spiritual care today. We're very happy to have Suyan with us. Tom White is past treasurer of the ACPE Foundation. Today, he is a leader in financial advising and entrepreneurship, which is a key word that many of you are dealing with, whether you like it or not, in spiritual care. And so he brings a very interesting perspective to what we're doing here. Amy Lawton is research manager for the Chaplaincy Innovation Lab and is behind so much of the hard data and the really nitty-gritty of what we're doing here. And so we're happy to have her. And then finally, Trace Haythorne, one of the lab's co-founders, again, one of our longest standing collaborators, and today a consultant and executive coach. And he will be really guiding the conversation for us today. Welcome to everyone. Thank you for joining us. Trace, I'll hand it to you.
Thanks, Michael. It's great to have everybody here. Happy New Year to those of you who are joining for the first time in this season. We'd love to start with a little bit of where we were back in December. In December, we talked about some research that Amy really helped spearhead for us. We created a Delphi panel to look at definitions of chaplaincy and spiritual care. And just to summarize quickly, what we came up with was really very strong consensus around the understanding of what a chaplain is. We came up with almost no consensus about spiritual care. That threw a wrench in this part of the project, which is really around what are the business models that sustain and support chaplaincy into the future. We know that there are many institutional forms of support for chaplaincy. Think of lots of healthcare institutions, but that tends to be institution by institution or hospital network by hospital network. The U.S. military has a support that comes through federal tax dollars, and there's been plenty of court cases and other things to be able to maintain that. But it's not limited just to the military. People are often surprised to learn that the CIA and the FBI and the Secret Service and even ICE have chaplains that are working with them. So there are federal chaplaincies. Also, federal prisons fit into that bucket as well. So there's a level of federal chaplaincy that's supported by federal dollars. If we move to state level for many of those institutions, many of those positions are volunteer. It varies quite a bit state by state, but we don't have a clear, sustainable model for what that looks like state by state. So we started wondering, what is a sustainable model for chaplaincy going forward? What might that look like? And we thought that we could do a case study beginning with the work of Lori Whitmore and her colleagues in Maine. Wendy Cadge, my co-founder and our close colleague, connected with Lori and began talking about the work that Lori had developed around something called SCS in Maine, which was her organization that was providing spiritual care basically on a contract basis. So they provided the chaplains where there was a request for spiritual care to take place. They started before the pandemic. When the pandemic hit, the state saw some real opportunities to have them provide support around the state. As many of you know, Maine is very rural, and so getting people out to be able to reach to people was a huge part of that conversation. And then the tragedy, the Lewiston shooting at the bowling alley took place, and that really galvanized the work of SCS. They were pulled to the forefront, not only to care for the families and the aggrieved, but also for the first responders and the folks in the community that needed support throughout that process. Over time, it's been harder and harder to sustain their work. Like a lot of entrepreneurial chaplaincy efforts, it's been built on a combination of what would be called soft money, so some donations from foundations or from the government, and then also from some private donors along the way. But they are still operating, and yet it is really hard to keep them operating. Their impact and their ability to do the things that they see the need is encumbered by the fact that they just don't have the financial resources to really make that happen. So that began to raise some questions for us of here was our case study that was going to be this model that helped us figure out how to think about business models. And as we dove deeper and deeper into this, we realized there's so much that we don't know that we need to know before we can begin to do any kind of recommendations or even outlines of what business models might look like. So I'll talk a little bit more about what that looks like when we get to the end of our conversation. But at this stage, we're at kind of a and now what moment. And we wanted to bring some folks in to let you hear from their perspectives, not just from inside the lab, but from Sue from an academic theological institution and her lens, and Tom from the world of finance, to be able to look and say, here's where we see some real issues and some real challenges as we look to the future. Amy, can you say a little bit more about where we are just in terms of the general research we've done and some of the things around demand and supply that we've done some work around as well?
Yeah, absolutely. So just to remind everyone about the framework we like to use for this, we do talk about the supply and demand for chaplaincy. The supply side is theological schools and other ways that chaplains are trained. The demand side is the end user, the spiritual care seeker or care recipient. There are a lot of other players who sort of find themselves moving between the supply and the demand side. For example, employers are supply side in the sense that they're the ones who are hiring chaplains, not using them, but they're the demand side in the sense that they're the recipient of people being sent from schools and training programs. So with this framework, this is the framework that underlaid our massive study that we did, um, the National Gallup survey that we did in 2022, which I know is probably starting to seem a little outdated if you come to a lot of these because it's the source of a lot of the information we have about people. But this is also a really cool indication of good research is getting a data set that not just answers your questions in the moment, but continues to answer your questions and continues to provoke new questions for many years into the future. So this was a great investment for the lab. This was the first nationally representative survey of asking people if they had ever talked to a chaplain. And when we were originally doing this first survey of the demand side, it was a little surprising to us that people would read our definition of chaplain and then tell us about somebody totally different. We were able to conclude that about 18% of American adults have definitely talked to who we would consider a chaplain, that consensus definition that Trace was talking about that emerged from the Delphi panel. The consensus definition was essentially it's a it's a spiritual caregiver in secular context, and it's good if they have some professional training. Um, so that was our definition at close to our definition at the time. That was the definition that 18% of Americans had met. When we start thinking about business models of spiritual care, one of the interesting resources we had were all the people who thought they had talked to a chaplain, but didn't actually talk to a chaplain. So we had a woman who talked about her sponsor in Al-Anon. She said that she connected with this woman as a chaplain because this woman had also had background in some indigenous religious practices, and she was just really excited to connect with her. This isn't a business model, right? This isn't a chaplain by our definition. The woman probably didn't think of herself as a chaplain, but she was put into that role of what we would normally call in the literature to be a spiritual friendship. Um, thinking about that, thinking about how that is something that people are looking for, and the more formalized relationship of spiritual companion or spiritual director got us thinking about, okay, well, where else are people finding quote unquote chaplains? And how are they interacting with them? So a couple other good stories that came from those interviews, because in addition to doing the 2,000 person survey, we did 50 follow-up in-depth qualitative interviews with people. And there was a woman who was a public defender in Florida. She considered her women's Bible group leader to be her chaplain. But most of what they did was not what we would think of as conventional Bible study. It was just like friendly outreach to neighbors. So that was sort of an interesting way of thinking about, oh, maybe there's like a community setting that we haven't explored yet, right? Like if maybe this is being called Bible study, but it's really kind of community organizing. There was another interesting story about a woman who was actually LDS and had great support in her church, but she was struggling because her daughter was losing her hearing, and she's connected to the audiologist um, for spiritual support. So that also got us thinking about, okay, there are these outpatient settings where you don't expect to have a chaplain, but the audiologist is an independent practice. It's not in the hospital. They don't have the resources of the hospital chaplain. But maybe we should be thinking about these outpatient practices. Maybe we should be thinking in a different way about, um, even medical supplies. Because when you go purchase a hearing aid, that you can go get that at Costco, right? But it's still a really intense and troubling experience for people. So we had all these different venues that we were really excited to think, wow, there might be somebody taking advantage of this, and there might also be like a different language to explore to explain this other than spiritual care. And by that I mean some of the things people told us really fit into the baskets of complementary and alternative medicine, which is a boom industry. There's a lot of money there. And that's not something that people generally get for free when they're embedded in another institution. And some of this fits into a little bit closer to what we would probably call the employee assistance program kind of side of things, right? More of like the HR. Um, where you're in settings where you wouldn't normally expect a chaplain, but it's something troubling that you need assistance with. You don't want to go to your actual HR representative, but who else do you go to? So this is where we were when we started looking for, okay, we've got Lori's model, we've got the legacy models, we have the legacy models of embedded in institutions, government chaplains. We know there are lots of volunteer chaplains in all kinds of exciting places, but what do they have in common? And more importantly, can any of these things be reproduced somewhere else? So that's where we started and kind of a hint of where we were going, and where we ended up on the research side.
Thanks, Amy. I think the other piece of that is we kept struggling with how do you monetize this? So, for example, I grew up in Dallas, Texas. My mama was born there. My granddad was born there. Our people go way back. And my mother has a very clear understanding of what um, faith and church are all about for her. And she can't imagine ever getting a bill being in the hospital where there was a line item that indicated spiritual care services on the bill. You don't pay for those things. That's stuff you're supposed to get for free. So, because of that, because I think she is illustrative of a larger ethos that's within the country, that people don't expect to have to pay for spiritual care services. So that dynamic is present in much of what we were looking at as well, and through a further wrench in the whole thing of then what's the business model? How do you make this work if you can't figure out a way to have people actually pay for it along the way? So um, really uh, interesting and exciting and somewhat frustrating because that's where we got stuck. And our hope is to eventually do further research. And again, I'll come back to that at the end of this. But let me invite Sue to respond to what you've heard so far and bring your perspective to the conversation.
Yeah, thank you, Trace, Amy, and the Chaplain's Innovation Lab. This is such an interesting and important conversation. This whole business idea of business model for chaplaincy, and I've been at Union for many years training religious leaders and chaplains, and I hear that same question over and over again, right? from current students, from alums, from prospective students. Will there be a chaplaincy placement for me when I graduate? What kind of work can I actually do with this degree if congregational ministry isn't my path? Can I make a living working as a chaplain? And this is resounding over and over again. And so I'm just really appreciative of this conversation and the research you're doing. And also, given the rising cost of an MDiv education, and of course, there are different models of seminary education too, this is an urgent question. And especially in our current higher education landscape, where every degree must prove its gainful employment track record, this is imperative, right? And we watch the federal student loan program being reshaped by the One Big Beautiful Bill Act. The question of sustainable business model for chaplaincy becomes not just valid, but urgent. So thank you. And so my comments here are as a review the report, what some of the comments, some of the things that surfaced for me. And Amy, you touched on a few of the things that I was going to comment on. So there's a lot of synergy here. So this is great. So in the report, I was struck by what Amy, you raised about the remarkably low consensus about what chaplains do, even if there is a high consensus about who chaplains are. And the report itself notes, and I quote, "There are two pieces of the same puzzle. What spiritual care is will always be closely related to how people find it and pay for it. To market spiritual care, we need greater theoretical and practical understanding," unquote. And I was sort of taken back to before COVID-19, chaplains being largely invisible to the broader public. And of course, this is all in the report, right? And I've been training, chaplains for decades, but it was only during and after the pandemic that every news outlet suddenly discovered them, particularly the hospital chaplains. And New York Times ran a piece on April 3rd titled "Men and Women Who Run Toward the Dying." I don't know if you remember this article, and it opens this way, and I quote from the article: "Few run toward the dying, even fewer run toward the contagious, but chaplains do. They minister to the sick before this pandemic turned their hospitals into war zones, and they will do so after this plague subsides, whenever that day comes," unquote. And you remember New York City was the ground zero of COVID-19. And it was all our life. This is what we thought about, worried about, lived out, and it was pretty dire. An article like this one brought chaplains to the forefront of our collective imagination. And at Union, applications from students interested in chaplaincy increased exponentially during and after COVID. In fact, it is even now our most sought after program. And yet, as you, Amy, you pointed out, there are wildly diverse understandings of what chaplains do. And this is due in part to the deeply contextual nature of any chaplaincy, right? Movement chaplaincy, animal chaplaincy, tech chaplains, port chaplains, eco chaplains. What do they do? What is spiritual care? And how do they sustain themselves doing it, especially these more non-traditional chaplaincy? So I really look forward to the further work on the theoretical and practical understanding that doesn't reduce chaplaincy to its lowest common denominator, but honors the contextual nature of it, even if it means that we can't have one neat job description that fits everyone. So I know this is a challenge for the research, and I kind of like it that we can't really agree on one thing. But might there be some ways that could be worked so that we don't go into the simplified version of what chaplains do, right? Second point I want to raise, and I'm referring to the 2023 Spiritual Vision for Spiritual Care document that's on the website. And outcome 2 of that document calls for increasing knowledge of and access to chaplaincy and spiritual care in traditional setting, and for consistent marketing or branding of chaplaincy. And I was intrigued by this notion, right? The lab has done a wonderful job highlighting what chaplains might look like, what they do. And so I really commend the work of the lab for several years. They've been on the forefront of this work. And perhaps a national branding initiative something to start a movement. The movement is already there, but something to call attention to the movement maybe is worth pursuing. And I think of the Conversation Project. I don't know if you know that project. It's the Conversation Project as a model. They've built a movement around getting people to talk about their end of life wishes, right? One of the taglines is like, it's not what's the matter with you, it's what matters to you. Very catchy. And they've created videos, marketing materials, all focused on helping people share their wishes for their care through the end of life. They are clear, they're focused, and it works. They reach different audience, younger generations, skillful use of technology and social media was key to any kind of their marketing. The third area I want to raise is a little sensitive, but we're talking about all options, the fee-for-service model. And Amy, I'm so glad you brought it to spiritual directors and spiritual guidance, because spiritual directors face a similar dilemma. Some are employed by institutions like a church or seminary, and other offer offer spiritual direction to congregants or students or staff. Others are volunteer, especially if they have other ways of making a living. But most spiritual directors charge a fee, sometimes on a sliding scale, sometimes at a fixed rate. This is common practice, and many spiritual direction training programs include conversation about fee structure and how to discuss them with clients. Part of the conversation involves clarity about what spiritual directors do and don't do. And this goes to the previous point about what do they do? What do we do, right? And how spiritual direction is not therapy, but accompaniment. They have clear guidelines and boundaries about their work. They name their approach explicitly. They have intake conversations. There's intentionality about what these sessions will be and will not be. So might we learn something from spiritual directors as we develop business models for chaplaincy? Fourth point, chaplaincy as part of multi-professional ecosystem for individual and societal care wellness. What do I mean by this? So just recently, about 3 weeks ago, I was exploring my health insurance app. And I think, Amy, you're also alluding to this when you talk about the employee assistance program. I was looking at my health insurance app just to see what I had access to. I was so surprised by how many benefits that I wasn't using were available to me, along with mental health coverage. There's also like legal service help, like if you want to have a financial conversation about how to structure your finances, all sorts of things. And then, along with mental health coverage, there were offerings in self-care and coaching. And I could access something like, and I quote, Calm Health, which included contents written by psychologists, mental health, screening tools, and mindfulness exercises, unquote. And I pay $0. What would it take for spiritual care to be an explicit part of these offerings? What kind of advocacy, kind of teaching would we need to demonstrate to the efficacy of spiritual care for individual and societal wellness? Of course, there are studies of this, the importance of spirituality for physical and mental well-being. Now, whether we should be entangled with the insurance industrial complex is a separate question, but I'm exploring all options here. So my last point concerns the 3 legacy business models identified in the report: institutional, religious, and volunteer. And I want us to think together about the volunteer model. If one of our goals is to approach this from the demand side, and speaking from someone who's on the supply side, so I'm trying to flip from the demand side, ensuring that people have access to spiritual care wherever they are, that it matters that consumers can access care regardless of whether the chaplain is paid or a volunteer. So I raise this cautiously because I am committed to the standards and competencies required for spiritual care, and just as committed to chaplains as a viable profession, not only vocationally, but financially. But as I also think about the model of Tzu Chi Foundation, it's a international humanitarian organization whose mission is to relieve suffering through its 4 great missions: charity, medical, education, and humanistic culture. Tzu Chi, grounded in humanistic Buddhism and the teachings of Master Cheng Yang, is built entirely on volunteerism. Volunteering is their practice. So how might we think about providing spiritual care if we took volunteerism seriously? It's already happening, but it almost seems like I want us to like bring it into the business model of it, right? Systematically as an important cultural value. How might theological education be involved not just in training professionals, but also informing volunteers who do not seek credentialing, but who can be equipped with skills and competencies to provide spiritual care? I know this is a complicated and sensitive issue, but I want us to consider all options, even as seminaries ourselves must rethink our own business models for offering theological education, as well as revision what theological education is and does to serve in these tumultuous times. So I just want to end with just a side note. It's a side but a related phenomenon where the multi-vocational nature of religious leadership is really gaining ground, not only because it's financially necessary, and that's maybe part of it, but because that is the vocational path. People like being in multiple contexts because it brings different pieces together in a way that just being a chaplain or just being in a congregational setting or just being in teaching setting or nonprofit itself do not satisfy in the same way. So let me pause here and we'll look forward to our conversation.
Thanks, Sue. Lots to chew on within that. And in some ways, you're making a great case of why I think we really need this next round of research to be able to build this up. Tom, let me invite you in as somebody who, though you have a degree in theology, your world has largely been on the financial side of a good deal of this. Tell me how you're seeing this. And also, we should give Tom thanks. He was a part of our advisory committee for this business part of our study work as well.
Oh, yeah. Thanks, Trace. Yeah, I mean, my background is in business, and so that's the lens that, kind of looking through with this. And, with the research that's already been done, I see a lot of data and perspectives from the supply side. And I think where, the next stage really should focus on is on the demand side. In terms of, we know that there is the capability and the desire to provide the services. What we're not so sure about is on the demand side as to how that's being, generated. Whether it's, through the federal agencies that already have it, or even other organizations that, and institutions that may not have chaplaincy already, but, want it. And I think, diving more into the demand side will very much help identify how we provide that supply. And how then do you charge for it? Because let the end user, the end customer tell you, what they're looking for and what they're willing to do, but what they're willing to pay and how. And so, I even, am curious out of, everybody that's on today, particularly the listeners and participants, what percentage, represent the demand side versus the supply side. And it may be that, it's mostly the supply side that's being represented today. And so I think we need to hear more from the institutions and people on the demand side to really match the supply and demand. And the other thing as well is that, for long-term perspective and solution, there needs to be some sort of institutionalizing of the solution, and not in the sense of creating some sort of an organization that, will last more than just one source of supply, which also could lead to the diversifying of risk amongst the sources of demand, so that it's not just a one-to-one relationship in terms of, a chaplain to an organization, whether, and I'm just, spitballing, whether it's a co-op type of organization. But I think that, that we need to look at it very much from a long-term perspective to be able to provide that consistency, and so that the people on the demand side know that it's a reliable solution.
These are great. And one of the pieces, I think one of the reasons we see a lot of folks who are on the supply side who jump into these conversations is this is the old chicken and pig thing around breakfast, right? They're not the ones who are bringing the eggs. They're the ones who may lose a whole side of themselves if we don't figure these things out and figure out how to make this sustainable. The the pieces that are really interesting as we think about co-op models, there's some places like the Healthcare Chaplaincy Network that has worked for many years to provide chaplains to different organizations. Corporate chaplaincy has done some of this work as well. One of the challenges that some of those organizations have found are things like benefits. How you provide healthcare, because of the way that benefits are structured within our country, providing healthcare and retirement to folks is very, very difficult when you're just putting them on a 1099. That falls back to the individual to try to manage that. If you are a contract employee, that's really, really tough. The other dynamic that I think we bumped into pretty consistently was, and I hesitate to say it out loud, but it's an ongoing issue, is some of the ongoing spats between the different chaplaincy associations and chaplaincy organizations that in many ways, one of my convictions has been this really ought to be a sandbox where we play together and imagine some really cool stuff for the future. That if we do this work well, the chaplaincy really could be the dominant form of religious leadership within this country as it becomes increasingly pluralistic. The problem is we're not treating it as a sandbox to play in. We treat it as a litter box. And I don't want to play in a litter box. Thanks very much. So figuring out some way for us to be colleagues towards a common interest and a common goal, even if we've got different ways of being formed and different ways of modeling some of the work, surely there's some way that we could form a chaplaincy UN, if lack of another definition, where we could have some conversations collectively and collaboratively. That doesn't solve the problems of paying for it. So really the next round of our work will be to dive in to return to the Templeton Religion Trust, using the data we found so far to really make the argument of, if we want this to be a sustainable form of work, we need to do a lot more research. We need to talk to a lot more people. As Tom mentioned, we really need to have some time with the demand side. And I think some of the work with the demand side is many people don't know why they would want a chaplain. They don't understand the work or understand how valuable it can be. So it's putting people who have already had positive experiences with people who might actually entertain that. Within the healthcare sector, there's some interesting shifts taking place as well. You'll see in our paper, we noted several positions were lost in the last year, and some of that is those institutions still recovering from COVID and trying to find any place they can to cut positions. Some of those institutions lost people because our chaplains were so busy bickering that we didn't actually do the work that was needed to be done. There are other places that have taken a very different approach. I know of a hospital system in West Virginia where there is one chaplain who serves 7 hospitals, and the administration has said the way that you'll manage this is through congregational clergy. And so that chaplain does trainings for volunteers who then come in and provide the spiritual care across these 7 different hospitals. That's certainly a model, but that's not a sustainable model in terms of the profession of chaplaincy and how vital we've seen that to be and in its emerging forms. So we offer all of these things to say, what questions or how can we clarify what we've shared today? Please feel free to drop questions in the chat, and Michael and I will try to pull those out and do our best job to support those. I see one right away about how a Hindu chaplain can see a light when there's no white paper or guidance as to how a Hindu chaplain can get trained. There's a growing demand for Hindu patients in hospitals across the nation. I'm happy to open that to Sue and Amy. I know you both have some familiarity with this. We also know that there is now a Hindu Chaplains Association. One of the members of our business team actually was one of the founders of that association. They are providing some good guidance and direction and helping identify places where people can get training and certification. one of the key questions in lots of areas of chaplaincy is what would be required for someone to have to be identified as qualified to do the work. So is that a degree? Is that a certificate? Is that a certification? And please know the words certificate and certification are very different in the professional world. Um, is that some sort of continuing education commitment and practice? What might those things be? Because it's different sector to sector as well. Healthcare is probably modeled most closely what licensing is in many other healthcare professions. But all of the other areas, it's a bit of a wild west. Sue, Amy, other suggestions for our Hindu chaplain?
I saw that Asha Shimon had put a link
Ah, thank
chat
you, Asha.
about the Hindu chaplain resources. So I would encourage for that. But I think the question is around the graduate level degree, 72-hour credit degree as part of the requirement for board certification, right? And I know there are some equivalencies that can be made, but that's one of the reasons why at Union we created the whole Buddhism and interreligious engagement track, because as a way to have another option for Buddhists to be trained for board certification by our degree, 78 credits. So it's built inside the regular other Christian tracks, but there's a separate track for our Buddhist students and Muslim students. But yeah, I think that just raising a point of that required graduate degree or credit that as an issue that needs to be resolved somehow.
And I'll just jump
Yeah,
in
thank
there
you.
to add that we have not had the opportunity to do an in-depth study of Hindu chaplains. The lab has an in-depth study of Buddhist chaplains, and a study of Jewish chaplains, and an in-depth study of non-religious or otherwise unaffiliated chaplains. And this was partly a product of who was funding it and partly a product of just like what the demand was, right? Like there was a huge demand of right now count how many Jewish chaplains we have, and we were able to estimate that with a given amount of margin of error, but pretty closely. Um, but I just sort of want to speak to this as somebody who has done this research, but also has the experience of I attended a theological school that was not my own tradition. And I just want to name that that is really difficult. And it's something that a lot of people are doing, many more than you would think. And there is some potential there for people to specifically network around having that experience of otherness. And it maybe might be it might not be as good as finding co-religionists, right? But people who are navigating that system with you can be a lot of help. So I just wanted to sort of put that out there that is not uncommon. And maybe there's some work we can do in that area. I think that would be really cool.
Yeah, I think that's great. I know that Tom mentioned the co-op model is one way of thinking about a business model. A couple of folks have asked about have we found any business models that are sustainable? And right now, the sustainable models are those that are institutionally based. When an institution decides that they want to pay for it, or that are a part of the federal government. Not even with state-based. We've seen, for example, in state prison chaplaincies, some states that were paying that decided that was going to be the way they saved a few bucks on their annual budget, which when you think about an annual state budget, this is a very small slice of what they're paying for. So that they decide to cut this is really unusual. There's one state, I will let them remain anonymous, where they cut all of their paid chaplains, and within 6 months, they had two cases of local congregational clergy smuggling contraband into the prison as a part of the worship service, which didn't go over well with the security. And within a year, they had paid chaplains back in place again because of the understanding that you can't just, this isn't just something that anybody can do. That's sort of the opinion that is often out there with folks on the demand side, that why do you need trained people to do this work? Can't anybody do this work? Aren't you just being nice and praying with people? Um, So that's part of the demand challenge as well, is it's not just helping people know about the service, it's also understanding what quality means within the service too.
Um, Mary Lou has an interesting question here, and it's something that I think a lot of chaplains grapple with, and we can sort of generalize it as well. You know, it is tempting to say, well, when we start talking about dollars and cents, we're taking away kind of the mystery of chaplaincy. We're taking away what makes it really distinctive and really unique. How do we take dollars and cents and apply that to spirituality? So maybe you all could just offer some general commentary of how you integrate those two things instead of saying, well, there's spiritual over here and there's worldly over here, and never the two shall meet. But how do we reconcile that?
So you want to try that one?
Sure. Um, I don't see a conflict. I wonder if, here's me advocating for volunteerism earlier and now saying I don't see a conflict. I think there's a huge range of where people fit into in terms of receiving something like for the salary or payment or for the service. And I understand that. And I don't see it necessarily as so if we make it not as a transactional, not just transactional, but that it's a offering or gift offering or appreciation or stewardship. I mean, we could put theological frame coming from Christian perspective around what this payment is. I think we tend to think about it because we're in a very transactional world where I do this for you and you pay me for the work we do. But that's also how you catch the conversation. I talked about the spiritual direction intake conversation. And part of that is, again, is saying this is my sliding fee. And one of the discernment of the person who's being the client is to discern what you can afford and what is appropriate for you, right? For so it's you can think about it not just as I'm purchasing, I am buying a service. So that's another, like if we're doing marketing or bigger thinking around this when you're bringing in money, how we might theologically really understand what that means and have a robust conversation about what is it. It's not just simply I'm paying. I mean, it's a fee for service. It sounds kind of transactional, but yeah, that's what I would advocate for. I mean, I don't see a conflict really. And because it's a different framework we have to put around what it is that we're asking. What is this thing? What is this money doing when it's passed around, right? So anyway, that's my initial thoughts.
Yeah, I think that's really helpful. I think the other piece within that is until or unless we have some sort of radical restructuring of the economic system within this country, um, this is what we've got. Transactional is a lot of the work that we have. Now, there are lots of different ways of structuring this. Tom and I've had some conversations about things like subscriptions, that people look at subscription service. Could somebody buy a block of time that then they could use at any time that works with a chaplain, that there's kind of an on-demand block of time thing that they could do? Or could that be something that their organization does and uses a chaplaincy service in that way? Are there things that we can learn from groups like BetterHelp that have figured out how to give lots of therapists ongoing steady income, just at theirs tends to be at a lower rate than what a therapist would get if they were in private practice. So what could we learn there that could also be helpful, because that addresses both supply and demand. And they do a lot of marketing. So a lot of it is putting out there that this service is available. There have been several questions that have come through at different times around the formation part for chaplains, again, the supply side and the role of CPE and all of that. I'm probably not going to touch that rail, considering I spent a decade very much immersed in those conversations. But all of that to say that I think we're at a really critical moment where, because so many seminaries and divinity schools now have tracks in chaplaincy that they didn't have even a decade ago, it's probably time to take more of a 30,000-foot look at the whole thing and what needs, again, that question that I raised earlier, what do people need to be able to demonstrate in terms of competency? And then very much focusing that on the demand side, because part of it is likely going to be driven by the demand side of what they think they need, not just what we think people should have. That seems to be a disconnect that's out there in the world, and that would be a part of the ongoing research that we do as well.
Sandra makes a really good point, and it has to do with Sue's comment on transactionality, who's paying, who's benefiting. And I think this is such a vital, vital point. But Sandra says if it's a paid service, then the people who might need it most could be cut off, right? Um, Deep poverty has deep spiritual implications. And so if the person funding the spiritual care does not have the means, then what does this look like? How is it even possible?
So I'll jump in here because we have a little bit of data about that. We haven't done an in-depth investigation, but we sort of have some interesting things to keep in mind as we're understanding the context. The first is that we can't start with the presumption that the quote unquote average American has access to spiritual care and that there are then people who are disadvantaged without access. There's actually huge swaths of Americans who are in very many ways the median American citizen who have not only no access to spiritual care, but no idea that it exists. So that's almost problem one, right? It's like, can we expand access at every level, not just at the level of people who cannot afford to pay for services? And then another related point that also came out of our earlier research is that people who have previously had an interaction with the chaplain often said in the survey that they would not expect to have another interaction with the chaplain, which was weird to us because if it's a positive experience and it helped you through a difficult time and you know you're going to have more difficult times in the future, why would you not want to talk to a chaplain again? And in the interviews, we dug into that and we found out that the reason was people had no idea how to access it. So we are talking to people who are, and I know a median American is a completely hypothetical thing, right? But the people who are in the fat middle part of the bell curve were telling us on Zoom calls that, yeah, I'd like to talk to a chaplain, but I'm not in the military anymore, and you're out of your mind if you think I know where to find a chaplain. So access is important, but access is actually much, much broader part of the conversation. Now, specifically to how do we provide to people if our calling is to provide to people who cannot pay, that is great conversation specifically for business models because you have business models like sliding scales. You have business models like scholarships, right? Where people who are can afford to pay, what they're essentially doing is paying a premium so that other people can participate. So an example of this is the programming from Abbey of the Arts, right? So it's a lot of good online programming for people who are connecting to their spirituality through art and writing. You can pay the base membership rate, or you can pay the higher rate that provides sponsorship to the people who can't. Sliding scale is very common in therapy. When I was a broke grad student, I was paying like, I don't know, $5 for therapy or something like that. It was really awesome. I'm no longer a broke grad student. I pay much, much more for therapy, but I'm grateful that that was available when I needed it, and I'm grateful to be able to provide that hopefully to other people. Um, and I think there's also something to be said because there's a sociologist, Ryan Burge, who has a Substack, Graphs About Religion. And if you are at all a data nerd, I totally encourage you to check it out because he makes the most wonderful bar graphs that explain all of the things that you wish you knew about American religion. And he has a graph out in the last couple days that was specifically showing that people who make less money and have lower levels of education, meaning maybe didn't finish high school, um, are much more lonely than people who have higher levels of education and higher levels of income. And that is uh, obviously expands this way beyond the topic of spiritual care, but I think it's worth mentioning because the the college graduate median income households, those people are also lonely. So to have this other disadvantage, this extra level of loneliness, we should, in addition to be saying spiritual care needs to be accessible to people, we also need to be saying, and we need stronger communities, and we need to be able to step up and know the names of our neighbors because our neighbors are also people who are suffering. So this is the sociological perspective more than the chaplaincy perspective, but I think it fits into these three buckets, right? Everybody needs access. People who are experiencing poverty and other forms of systemic disadvantage need more access. And there are models out there to explore. So, thank you.
Thank you, Amy. I noticed there have been several comments that have come through, a lot of healthcare-based folks talking about telehealth and telechaplaincy, and as one of the ways of being able to reach people who don't have direct access to things. There's still some assumptions within that around both access and the quality of the tools that you use to have that access, the machines, the internet lines, and access piece. So we're not there yet, but there are some things that are beginning to improve in that area that might make some of this more available to folks. And I think one of the questions that we continue to have is spiritual care explicitly a form of health? We've got several of our healthcare institutions that think of spiritual care in that way. We don't have data to say whether people in other sectors are thinking of it in the same way. Is it a part of health or mental health or well-being? And so, as we continue to do research, we'll be exploring that more fully as we make our way. Michael, I can see that we're getting pretty close to time. I noticed a couple of folks were asking for some information about where to find information and articles on the lab website. Do you want to say a little bit about that?
Yeah, sure. So if you go to the lab's website, you'll see one of the top things on the menu says resources, and if you hit that drop down, research is one of them. And so anytime we publish new research, it goes there. Everything that is pertinent to this project will be contained in the follow-up email that you will get here in about a week or so after this event is over. And then, of course, if folks have specific questions about various topics, they're always free to reach out to us at info@chaplaincyinnovation.org, and we can either hand it to you or tell you who has it or whatever. Some really good comments in the chat there, folks. I would encourage you to scroll through that and see what some of the conversation has included. I really like this comment from Jason, who says we need to access the chaplains that are already embedded in communities and organizations who aren't necessarily going by the title of chaplain. I like the comment. We can't keep looking at folks from traditional chaplain factories to solve the issue, because, of course, those factories, so to say, can only produce so many chaplains, and they're going to be doing chaplaincy in a very specific way. And so, being creative about who we consider doing the work of chaplaincy is vital here. Any final words from our panelists before we close out?
Michael, I'll jump in on one other question that Cheryl had, Moore
Yeah.
Tucker, about whether there are any conferences or places where these kinds of business models are being discussed. We've seen some sessions where, some folks might have had a small panel that have addressed it, but my hope is that if we're able to land the next Templeton grant, if we're able to build on this work that we've been doing, that part of the culmination of that work would be in a kind of very interactive conference where folks can come and bring the models that they've worked with and what's worked for them, but also explore new models and begin to imagine together just what we might build. Trying to create, again, that sandbox that can be a real generative space. Tom, any parting thoughts as we wrap up?
Um, no, I mean, there's a lot of great perspectives on here, and I think, the next step is going to be critical in really identifying, what the long-term solution is. And as I've said before, I think the focus should be on the demand side. I mean, there's no question that we have the capability to provide the service, and let those that are seeking the service tell us how to provide it, and I think we'll get more answers that way.
Thanks. Sue?
No, just appreciation for this ongoing work and really, this is an urgent and important matter. So I'm grateful and I'm happy to be in further conversation with you throughout this whole process.
Thank you. Thank you both for joining us. Amy, any words from you?
Yeah, thank you for bearing with my TED Talk on sociological data. I know it's not everybody's cup of tea. I think it's important to ground it in data as much as possible, but that doesn't mean that we should lose touch with the spiritual or religious side of this as well. So I do want to say that I've seen that comment in the chat, and I appreciate that very much as a sociologist of religion. Um, I mostly just want to give a shout out, not just to the people on the call who are all awesome, but the chat has been just on fire for this webinar. Like, this is like, people are really excited. And this is really, this tells me we're asking the right questions, we're going in the right direction. It tells me that we should get more funding for this because it is important and it is exactly like what practitioners are thinking about. So thank you all. It's fantastic. Just love it so much.
Yeah, I would echo that. And every one of these comments is just good data for us as we're making the case to Templeton to consider a new grant. So thank you for your participation in this. Michael, take us home.
Well, thank you all so much for joining us. And what's best about having a robust chat like we did today is that no one's even arguing. How often does that happen? So thank you all for not only entering into discussion, but doing it fruitfully and kindly and graciously with one another, because we all need more of that right now in our lives. You will get a recording of this event in about a week or so. Give us some time to get it all set up. That'll come straight to your email. You can watch whenever you like. Please share it widely. Especially with administrators, decision makers, let them see that this is something that the profession is thinking about very hard. And it's something that we want to be in partnership and conversation with institutions moving forward. Thank you all so much. Have a great rest of your week and wonderful weekend. Bye bye.